Good afternoon, everyone. I'm Beth, the Santis, the CEO of Fact Forward, where we work to advance the reproductive health for young people and adolescents. And today, if you're seeing this, you probably already know that April is STD Awareness Month. In addition to that, this week is STD Awareness Week. This week, we're really focusing on how parents and new serving professionals can help the young people in their lives prepare before they're in the heat of the moment. We're here with Dr. Jessica Tillman from the Division of STD, HIV and Viral Hepatitis at the South Carolina Department of Health and Environmental Control to get her insight on how trusted adults can talk openly with the young people in their lives. Thank you for joining me, Dr. Tillman. Let's set the stage about the state of STIs in the state of South Carolina before we dive into how trusted adults can actually lead the conversation. So my first question, what do people, especially parents and trusted adults, need to know?
Well, thank you for having me, Beth. Parents and trusted adults need to know that sexual health is an important part of emerging adulthood. So it's important to establish a strong foundation built with accurate information and maintained with ongoing support and trust so that young people have what they need to make decisions that will set them on a path toward healthy and happy lives. While STIs affect people of all ages, young people carry a lot of the load. The CDC, the Centers for Disease Control and Prevention, estimates that youth 15 to 24 years old accounted for almost half of the 26 million new STIs that occurred in the United States in 2018. That trend was similar in South Carolina, as young people accounted for 66% of chlamydia cases and 52% of gonorrhea cases in 2018. But please keep in mind that these numbers are based on what's reported to the CDC, which means that people must actually get tested for STIs, and then those positive STI test results have to be reported. So it's likely that the true numbers of STIs are even higher. If young people are hesitant or afraid to seek care, or they're unaware of their risk for infection, then they're not even getting tested and treated. Those young people are hidden and therefore not counted in these numbers. As numbers from 2020 and beyond are reported, we must consider how the COVID-19 pandemic reduced access to sexual health services, with some healthcare providers reducing their capacity to provide services. For example, they reduced their hours of operation, or they reduced the number of available appointments, or they even closed completely. Parents and trusted adults must understand that STIs are out there, but with factual information and support, young people can protect themselves from infections and get prompt and effective treatment if they do get an STI. The CDC has a lot of information on their website, www.cdc.gov/STD, and the homepage features a link to a section for adolescents and young adults.
That's awesome. The information you just shared is so timely and is so important to increase awareness about the issue. In your experience, what keeps young people from talking to the trusted adults in their life about healthy relationships and about safe sex?
Well, the key word in your question is trust. I think that young people are more likely to talk about healthy relationships and safe sex with adults they trust and feel safe with, physically safe, emotionally safe, and so on. When I was a PhD student, my research focused on young women who were diagnosed with pelvic inflammatory disease, also known as PID. PID is primarily caused by STIs such as gonorrhea and chlamydia. As part of my research study, I interviewed young women to explore their experiences with PID. I asked the young women who they told about their PID diagnosis and why. When it came to disclosing their PID diagnosis to people other than their sex partners, who of course needed to know for treatment purposes, there were two main questions that the young women asked themselves as they were deciding who to tell. Number one, is this person going to judge me? And number two, is this person going to help me? If the answer to those questions was no, then they did not disclose their PID diagnosis. I think those questions also apply as young people decide which adults they're going to talk to about healthy relationships and safe sex. Of course, adults have standards and expectations and want the best for the young people in their lives, but their interactions with young people must make the young people feel secure about talking about topics that can be awkward or uncomfortable to discuss. Negative reactions to what they say, whether real or anticipated, can cause young people to withdraw. Adults should be open, non-judgmental, and supportive.
So more about that. How can parents and trusted adults be intentional with the conversation to support the young people in their life in STI prevention?
It might be a challenge to start the conversation out of the blue, so try to connect the conversation to other things going on. Kids learn at an early age about germs, so they should learn at age-appropriate levels that there are some germs or infections that they can get from sexual activity. Ask them what they've heard about STI prevention and clarify myths about infections, such as getting them from toilet seats or any unconventional, unreliable ways to prevent infections. And also build on the conversation as they get older. And I also recommend considering the content of a lot of entertainment these days. Watching TV and movies and listening to music can also provide opportunities to have intentional conversations about STI prevention.
That is so true. And if you're sexually active, getting tested is one of the most important things you can do to protect your own health. What are the various methods of testing trusted adults can talk with their young people about?
In-person testing is the most common STI testing option and is performed at various types of locations such as doctor's offices, federally qualified health centers, community-based organizations, and public health department clinics. There are some companies that provide at-home testing, meaning that the person collects their own specimens at home and then sends them away to be tested. The costs vary for tests, as some are free, while they can go up to hundreds of dollars. It's important to be aware of what tests will be performed, so encourage young people to ask about the test if the person testing them doesn't explain that in advance. Different tests require different specimens. For example, blood isn't tested for chlamydia and urine isn't tested for syphilis. So depending on the specimens that are collected, that also determines what tests are being performed. So it's important to know what you're actually being tested for. The CDC has a campaign called GYT, Get Yourself Tested, to encourage young people to get tested and treated for STIs. And that information is available on the CDC website. I also recommend visiting the DHEC website and using the HIV STD and hepatitis C testing locator to find places to get tested for STIs. Some young people may be hesitant to seek sexual health care services because they don't want their parents to find out, but it is possible for young people to receive STI treatment, testing, and counseling services without parental permission or involvement. But of course, talking to a trusted adult is encouraged.
Absolutely. There's actually a lot of times a negative stigma attached to contracting an STI. How can parents and trusted adults navigate this if their young person comes to them after testing positive for an STI?
Testing positive for an STI may be shocking, disappointing, or upsetting, but be supportive. Acknowledge that they came to you with this issue. Ask them how they feel about it, and then listen. Ask how you can help them. Avoid blaming and shaming, and have a constructive conversation about lessons learned. Discuss their next steps and ways to prevent it from happening again. All STIs are treatable, and many STIs are curable, as in they can go away completely after taking medication. The numbers show that STIs happen to a lot of people, so let the young people know they're not alone. And people who get STIs can go on to live regular lives, so be encouraging.
All right, that's all great advice. I do want to end our discussion with any final thoughts you want to leave the Fact Forward viewers with. What do you hope people get out of awareness weeks and months like this?
I hope that people will learn more about STIs because increased knowledge can reduce stigma, fear, and discrimination, and also lead to improved health. I also hope that people take advantage of STI testing opportunities to know for sure that they don't have infections that can be spread to their partners, or in some cases, to find out that they have an STI and get treatment for it.
Awesome. Thank you again for sharing your time and especially your expertise with us. Are there any events your organization is doing that we can mention here?
Today, Tuesday, April 12th, in observation of STD Awareness Week, many South Carolina DHEC clinics are providing STI tests at no cost. The available tests are for chlamydia, gonorrhea, syphilis, HIV, and hepatitis C. Appointments are encouraged and may be scheduled by calling DHEC's care line at 1-855-472-3432.
That's awesome. Thank you very much. And if any of our viewers need more information, there's plenty of information available at the CDC website. DHEC is also a great place to go, as well as factforward.org. We're here to raise awareness and to thank you, Dr. Tillman. Have a great rest of the STD Awareness Week and the Awareness Month. Thank you for all you do for all of us. Have a great day.
Thank you for having me.